Good morning everyone, myself I Sinduri, second year junior resident dermatology. Today my topic is platelet rich plasma, also known as platelet concentrated plasma or platelet rich growth factors. So the precursor cells of platelets of megakaryocytes, and the role of platelets is hemostasis and tissue healing. Almost 7 growth factors are present in platelets and 3 proteins, mainly fibrin, fibrinolactin and vitronectin are present. So the activation of platelets leads to granule fused to membrane and secreted out, act on target mesenchymal stem cells, osteoblast, fibroblast, endothelial cells and epidermal cells, leading to intracellular signaling and cellular proliferation, matrix formation, osteoid production, collagen synthesis, repair and regeneration of the tissues. So the types of globules present in platelets are dense granules, alpha granules and lysosomes. So most of the growth factors produced by platelets are from alpha granules. So the growth factors present in platelet are platelet-derived growth factor, vascular endothelial growth factor, epithelial growth factor, fibroblast growth factor, tumoral growth factor, and insulin-like growth factor 1. So being autologous, that is that PRP is obtained from the same individual, there is no chance of any cross infections or any kind of rejection or tissue reactions like graft versus host disease. So the normal platelet count in an individual ranges from 1,50,000 to 4,50,000 per microliter in blood. In PRP, we aim to get 3 to 8-fold increase in platelet count. So the working definition of PRP is platelet count of 10 lakh per microliter in 5 ml of PRP. Before knowing indications of a procedure or drug, it is important to know contraindication. The contraindications of PRP are absolute and relative. Absolute contraindications are critical thrombocytopenia, wherein platelet count is less than 50,000 per microliter. Platelet dysfunction syndromes, sepsis, hemodynamic instability like collapse, hypofibrinogenemia. Relative contraindications are HB less than 10 gram %, platelet count less than 1 lakh, NSAIDs intake less than 48 hours before procedure, intralesional corticosteroids taken at the site of PRP less than 1 month, oral corticosteroids, local site infection, history of herpes simplex infection, because that can increase the chances of recurrence. So if history is present, it is better to give acyclovir 400 mg BD for 7 days prior to procedure. Any history of fever, illness or malignancy will be a relative contraindication. And the indications of PRP is pattern hair loss, which is a recent nomenclature of androgenetic alopecia or female pattern baldness. Facial rejuvenation, wrinkles, photo damage and discoloration, alopecia areata, scarring alopecia, vitiligo, melasma, striatisdency, lichen sclerosis, lipodermatosclerosis, refractory nail diseases. Any chronic or acute ulcers due to any etiology like diabetic foot ulcer, pressure ulcer, Hansen's, skin graft donor sites, first and second degree thermal burns, post-traumatic scars. Ocular indications may include dry eye and eyelid injection. Urological indications may include urinary incontinence and sexual wellness. Sports medicine and industry also have their applied uses. Coming to androgenetic alopecia, the way it works is by lengthening the anagen phase, promote development of hair follicles, apoptosis of hair follicles is downregulated, angiogenesis in follicular area is increased. So the way it is given is interfollicular PRP injection 0.05 to 0.1 per centimeter square is given in retrograde manner, deep to superficial way. Other methods are mesotherapy, where microneedling is done followed by interfollicular PRP injection. Other ways sprayed topically on scalp and left over overnight. One more modality is where dalteparin, low molecular weight heparin and protamine microparticles are combined with PRP and given. So duration which is usually followed is injections over 3 to 4 monthly till improvement, and then every 6 monthly for maintenance. In skin rejuvenation, platelet-derived growth factors plays an important role in blood vessel formation, collagen synthesis, and extracellular matrix, including hyaluronic acid, thus promoting healing of photo-damaged skin elasticity, and cosmetic appearance. Whereas tumor growth factor beta plays important role in inhibiting melanin synthesis, so helpful in melasma and other kind of hyperpigmentation. In acne scar, the standalone treatment of PRP is not fully recommended. It is used synergistic with microneedling and other combinations with PRP in acne scars, a fat graft 1540 nanometer non-ablative laser. In rejuvenation, the results of PRP is applied by superficial deep injection. The skin texture, tone, firmness improve within 3 weeks with ongoing improvement for next 3 months. Areas commonly treated for rejuvenation are forehead frown lines, bunny lines, around eyes, jawline, back of the hand, neck, knees, elbows, upper arms, and post-pregnancy stretch marks. Open and chronic wounds are treated with PRP in combination with hyaluronic acid. So here is the picture from a study wherein with a follow-up case of prior to PRP, first, second and third sittings of PRP, we can see the decrease in hollowness around the eyes, decrease in pigmentation and decrease in fine lines. This is a follow-up case of androgenetic alopecia. In trichoscopy, we can see the increase in hair shaft diameter and hair follicular density. And this is a case of melasma with uchronosis. There are two different cases. We can see the improvement in pigmentation and skin texture. And this is a case of non-healing ulcer with PRP. We can see gradual improvement in the ulcer and reepithelialization. So pre-procedure of workup. We have to do all pre-procedure investigation, complete blood count, CBC, BTCT and viral markers before the procedure. Global photographs are important to explain, to see the outcome of the patient. And trichoscopy, which including hair diameter and density, Massey score for melasma, smear culture and antibiotic sensitivity in case of chronic ulcers. Wash with povidone iodine shampoo from 2 days prior to androgenetic alopecia is suggested. Antibiotic coverage can be given 1 day prior to starting. This is the consent which is important and it is given by IDPL. Pain management can be done by eutectic mixture of lignocaine and adrenaline. Lignocaine field block can also be done. 10% lignocaine spray. Pain destruction techniques like vibration tool and cold compress can be used. So coming to important slide of today's discussion, facets of PRP. IIDBL has introduced great framework task force to give certain recommendation for uniformization of PRP procedure. So while doing the procedure, we use wide bore needle of 21 gauge or larger to decrease platelet lysis and for effective extraction of platelet. 40 to 60 ml is taken. Time should be restricted less than 120 seconds beginning from the time the blood is withdrawn to the starting of PRP procedure in centrifuge. Double spin method is preferred over single spin. The preferred anticoagulant is acid citrate dextrose than trisodium citrate because acid citrate dextrose decreases calcium ion concentration, thereby decreasing the platelet aggregation. EDTA is not preferred because it will cause platelet cell lysis. Centrifuge parameters are first spin, which is also called as soft spin, 130 rotation per minute for 15 minutes. Second spin or hard spin with 1600 for 15 minutes. So 1 to 1.5 million platelets per microliter or required for the PRP. Temperature should be maintained 20 to 25 degrees centigrade, which is near room temperature. A microprocessor's controlled centrifuge with brushless motor and swing out rotor is the preferred centrifuge. Double spin open method is preferred method. So centrifugation, relative centrifugal force that is required to separate two phases of blood. Unit of relative centrifugal force is G, and G is calculated by the following formula, wherein G represents relative centrifugal force, R is radius of the rotor, S is speed of the rotation in RPM. So principles of centrifugation is, it depends on differential centrifugation, which is depending on the specific gravity of the cells, they get sedimented. RBC being high specific gravity, it settles first, followed by WBC, followed by platelets and plasma. So, depending on the supernatant we draw after first spin, we get different types of PRP. That is pure platelet-rich plasma, which is rich in platelets, poor in leukocytes, poor in fibrin, leukocytes and platelet-rich plasma, which is rich in platelets, rich in leukocytes and poor in fibrin. Pure platelet-rich fibrin, which is rich in platelets, poor in leukocytes and rich in fibrin. Leukocyte, pure platelet, rich fibrin, which is rich in platelets, rich in leukocytes and rich in fibrin. So there are two methods of preparation of PRP, open and closed method. So these are different kind of vacutainers that can be used. Left one being the plastic conical vacutainer that is disposable, and middle one is glass vacutainer, which is most commonly used, and the rightmost one is acid citrate dextrose containing vacutainer. So the procedure is we will draw the blood sample from bigger vein like cubital vein with greater than 20 gauge needle. So we usually collect 40 to 60 ml of blood with 8.5 ml being the blood and 1.5 ml being anticoagulant. So after first spin, which is 1300 for 15 minutes, we get 3 layers. Topmost layer is plasma and bottommost layer is RBCs. After first spin, we will take the plasma and a little bit of RBCs and we subject it to second spin, which is hard spin, which is 1600 for 15 minutes. After that, we get bottommost layer containing RBCs and platelet pellet, followed by platelet poor plasma. We can discard the platelet poor plasma or preserve it for using as a biofillers in acne scars, and the remaining bottommost 1/4 of plasma and platelet pellet or resuspended by tilting the test tubes 2 to 3 times, and it can be used for further PRP. So coming to difference between PRP and platelet-rich fibrin, centrifugation speed during PRP is usually high speed. In PRF, we maintain low speed. Anticoagulant is used in PRP. In PRF, anticoagulant is not used. Fibrin matrix is present in case of PRF. Platelet concentration is usually high in PRF. Growth factor release is sustained over 7 to 10 days in PRF. WBC or retain in PRF, therefore enhancing the healing. Consistency is gel-like in case of PRF. Application is, for the PRF, it is used as a clot membrane or injectable, whereas PRP is injected or microneedled. And the difference between standard PRP and GFC are during preparation. In GFC, additional processing to extract and concentrate growth factor is done. Growth factor concentration in GFC is 4 to 10 times higher than that of standard PRP. Presence of platelets are lysed to release pure growth factor in case of GFC. Inflammatory response is reduced in GFC as unwanted proteins are removed. In GFC, we get more prolonged and sustained healing effect. In GFC, after collecting the blood, we will subject it to cryotherapy, liquid nitrogen at 196 degrees centigrade, so that the unwanted cells can be removed. So these are variants of PRP. The first one is syringe only method of PRP, where the wings of the syringe are cutted and blood is drawn in 5 ml syringes, and syringes are loaded in the centrifuge with piston down. RBCs settle in the bottom of the syringe, that is toward the piston. The supernatant is transferred in a three-way different syringe using 3-way cannula, and the PRP can be used for further procedure. And next one is turn down, turn up method of preparation of PRP. Vacutainer is placed in centrifuge top down. RBC sediment toward the rubber stopper, extracted with 10 cc syringe. Vacutainer is placed in regular fashion for the second spin, and PRP is prepared. And closed method of preparation is the one where there is no environment exposure after sample collection, and following methods are come under closed preparation. Narrow neck method, gel separated method, where 1 to 2 ml of thioxotropium polymer gel is added, or automatic cell separated. In narrow neck, either ends of narrow neck tube is broadened and it has the center narrow neck. So the blood is added with anticoagulant in the narrow neck tube. After single spin, RBC settle down and the Buffy coat is difficult to pick up. So we turn the screw to make Buffy coat into narrow neck. The narrow neck elongates the Buffy coat, make it easy to pick up. Needle is inserted from the top and Buffy coat is directly picked up. And thioxotropic gel, it is based on principle that thioxotropic gel has low specific gravity than RBC and high specific gravity than platelets. So RBC settles down below thioxotropic gel and platelets go above thioxotropic gel, thereby PRP can be obtained. Activation of PRP, it is not required if we use it for soft tissues like in androgenetic alopecia. Basis of activation is to release the growth factor and cleavage of fibrinogen to form a matrix. Agents used is calcium chloride, 0.01 ml in 1 ml of PRP, thrombin, a combination of thrombin and calcium chloride, and type 1 collagen, which is naturally present. And devices are following. Thank you.